If you want to take no chances, and I'm not judging anybody for anything, the emotional trauma you've gone through, the money you've paid, it's awful.
How do Librela and Solensia work?
They work on mitigating nerve growth factor. So they don't necessarily prevent osteoarthritis from happening. And in most cases, it's already happening. Otherwise, it would not be prescribed. What it does, it helps the pets not feel they are in pain. But we should probably back up a little and talk about osteoarthritis and the need for these drugs in the first place, which I would argue has increased over the years, particularly in recent years. So if you go back, and I'm about to, I think, shock you, if you go back long enough, veterinary professionals and animal behaviorists didn't think our pets even suffered from pain. And I can't explain why that would be the case, but today we know, and let me say that again, we know what the wiring looks like, if you will, neurologically in companion animals. And dogs in particular, and cats, so close to the same as ours. And I know it kind of doesn't make sense in a way because, 100 years ago, if a dog's tail got caught in the door, the dog yelped, right? The same is true if the dog's tail gets caught in the door tomorrow. But we've known for a long time as pet parents, instinctively, that our pets feel pain. Why this was something that was felt, I don't know. Then later on, okay, we understand our pets are in pain, but maybe we shouldn't be so proactive about treating it, because that way we can tell, because we can't ask them how they're feeling, so we can tell by signs of pain, and they can recover faster this way if we keep them confined. For example, a dog undergoing knee surgery, if it's confined in one place and it hurts too much to move a lot, that dog will indeed recover faster. So am I making any sense?
Absolutely, yes.
As far as the history of all this. Then pain medications, including non-steroidal anti-inflammatory drugs, began to come about. At first, they were used in human medicine drugs for companion animals. But in 1997, Rimadyl came. I didn't mean to do that. Rimadyl, but it was a good thing. Rimadyl came about. And I guess Zoom is smarter than I am. They knew I was happy about that. Rimadyl came about, and then a flurry of drugs followed that are non-steroidal anti-inflammatory drugs for dogs. In cats, it's a bit more difficult. And the other factor to better understand is osteoarthritis itself. So I don't have to explain to many people that this is debilitating. Few of us don't know someone who has arthritis. Osteoarthritis refers to arthritis of the bone. It's just a fancy way of saying it. It's painful. We know that, right? We all know someone who gets up in the morning, maybe yourself, and is rather creaky, slow moving, and then throughout the day begins to feel a little better, or maybe even be more debilitated than that by arthritis. It is the same for our pets. And in fact, as our pets age, they are more likely, as we age, to have arthritis, all of which appears to be common sense. The thing is that we have pets that are living longer than ever before. The other thing is we're getting better at understanding how pets are telling us they hurt. So cats, for sure, are stoic. They are great magicians. They are determined not to tell us they're in pain. Now, they don't get up in the morning thinking, I am not going to tell him I hurt. However, they're hardwired not to demonstrate that they're in pain. Because if a cat is, say, outdoors, living like a cat did, in some cases, you're in the UK every single day because so many cats are outside. But like cats did, especially hundreds of years ago, and cats are still wired the same way, they're both predator and prey. So if they don't mask that they're hurting, they become potentially dinner. So they are hardwired not to demonstrate that they are hurting. They automatically do anything and everything they can not to show you that they are in pain. Actually, dogs, it's more true than we think, being the same. So it depends on the individual dog. Some dogs are going to tell you the second they hurt. Other dogs are going to mask that pain as well. Also, we now have data that we didn't have just a few years ago. Cats and dogs, how many actually are suffering pain? Cats and dogs, what the signs of pain are. Now, that's a whole different conversation, but some might surprise you, particularly for cats, as to what the signs of pain are. A cat that is sleeping more, okay, that might not surprise you. A cat that's going up or downstairs, a cat that goes up or downstairs differently than previously. So, in other words, a cat that goes diagonally upstairs or downstairs. Yes, definitely a cat that's going slower. A cat that hesitates. That hesitation in dogs or cats may be eyesight, because we're often dealing with older animals. So it's more, is it pain? Is it that the dog really can't see where the stair is? Is it the dog feels unsteady because it's not carpeted, but rather on tile? It's hard to say where one issue begins or ends necessarily. But cats, for example, what I tell people to do now is video their cat every year. And at some point in time, when the cat reaches the age of maybe 10, that cat, instead of flying off the end table, is going to kind of slide down the end table. They instinctively do this so they're not pounding on their joints. They don't read a book about it. They don't necessarily follow this conversation about it. They just instinctively do that. Will you, as a pet parent, be able to distinguish that's happening? Probably not. And actually, I have seen videos of cats doing that. I can't catch it unless it's in slow motion, believe it or not. That's how subtle all of this can be. Other signs of pain in cats could be a cat that just kind of scrunched up like this. Now, a cat that's 12 years old is going to be sleeping more than a cat that's 4 years old. And cats in general like to sleep anyway, right? So the cat that's sleeping, that's a bit more scrunched up, how do you tell if the cat's a bit more scrunched up? We are going to have tools, speaking of phones, on our phones through artificial intelligence within the next couple of years that will tell you, just by taking a picture of your cat, that that cat's in pain. It is hard to tell. Now, if we had someone with a keen eye, watch the way she just walked in back of my chair. She walked kind of like this, kind of like old men walk or old women walk, right? No offense to anybody, but she did, right? And you could tell that or you would suggest that there's a reason for that, and the reason is pain. So no one wants their companion animal to be in pain. I don't believe. With cats, we've not been able to do a lot about it. In the United States, there has not been a pharmaceutical that has been made specifically for cats to deal with pain. What's been done for cats, which I'd argue is more challenging than dogs. Yeah, so let me back up a little bit. One more thing. It has always been thought that cats, because they're small, and something else, cats, because they're small, are less likely to ever suffer arthritis. That was the thinking. And that, I guess it kind of makes sense in some ways, right? But it turns out not to be true. So cats are equally or even more predisposed to osteoarthritis than dogs are, believe it or not. The other thinking had been, okay, yes, Labradors, certainly dogs bigger than that. Newfoundlands, all those dogs, they suffer arthritis because of their size, if nothing else. Small dogs do. Well, there's one right there. She's 9 pounds. So small dogs do too. There's no doubt about that. Also, in America, and I'm not sure what the data is in the UK, but it's about the same. In America, 61% of cats are overweight or obese, and half the dogs are. So that exasperates the issue right there. So osteoarthritis is more common in older animals, and it is more common in animals that are overweight and obese, because we have millions, literally, of animals that are both older and overweight or obese. That actually likely potentially increases the number. Also, as we better understand what to look for, as I was yapping about for a few minutes earlier, what determines if a cat or a dog is in pain in the first place. So you can x-ray cats or dogs or people. And so Your doctor can x-ray your knee and say, oh my gosh, that's bone on bone. I could actually feel more pain than you. It's all individual. And we don't understand for humans, to my knowledge, I'm not a human doctor. We don't understand in humans why that's the case, let alone in companion animals. Now, I think it's important to understand all of that as a backdrop. A need to do something about pain that is effective. In cats, as I said, we've used what's called a multimodal approach and all kinds of things. And I could talk about some of those things in combination, in conjunction with one another. But there has not been something targeted specifically for cats. For dogs, there has been, but the effectiveness varies. The other thing is, these are often older or even geriatric animals. Geriatric animals or older animals also have comorbidities or other conditions, medical conditions, that make it impossible. Cats, kidney disease and GI issues, dogs, GI issues, most common, but others potentially as well, that make it impossible to take a non-steroidal or nearly impossible to comfortably take a non-steroidal anti-inflammatory drug.
Right.
So when other options became available, people like myself, been talking about pain in animals for years, long before I knew about even the possibility of Solensia or Librela. Okay, so how do you distinguish your pets in pain? And then what might you do about it in conjunction? Because there has been in dogs, especially in cats, no magic pill. And to my limited knowledge, in humans, there's still no magic pill.
Right.
So there are things that can help a lot. And it turns out that millions of animals around the globe are being helped by both of these monoclonal antibodies. Now, that's the longest answer you've ever heard.
No, it's great. It's packed with information, really. It's absolutely packed with information. So the target audience for these treatments tend to be, as we've said, geriatric dogs and cats.
Older animals. Well, I want to make a distinguishment here. Distinguishment? I don't even know if that's a word, but it is now. I want to distinguish. So yes, older. Yes, geriatric, which depending on our definitions here are two different things. But it's not only that, but you're absolutely right. Most of the animals, dogs and cats here, are older. Many are geriatric, but a surprising number of cats that are, say, 6 years old begin to suffer from arthritis. And the earlier it's caught, the less damage is done. The same for dogs.
Yeah, right. Okay, so that would be the primary target audience for these treatments. Would you explore other options or treatments for dogs and cats with arthritis before prescribing the Solensia and Librela?
I don't know. So let me explain that answer. All of our pets are individuals. We are all individuals. So in the United States, for Librela or Solensia, as just one example, an injection ideally administered by a veterinary professional needs to happen once a month. If the client lives nowhere near a veterinary clinic, and there are places, not many, but there certainly are places in America where that's the case, maybe it's not the best option. If there is a concurrent neurological problem in a dog, Librela would not be the best option. And on and on and on. Every pet's an individual. Every pet family is an individual family. And for what works for one is not necessarily going to work for another.
Right. Okay.
Does that make sense?
Yeah, absolutely. I mean, we do advocate for glucosamine, for example, to help with arthritis. My dog is almost 10, and he's been on glucosamine tablets for a while, and they do help. They're probably not as effective as Solensia, but they do really help. Something like hydrotherapy, for example, is becoming quite popular as well, and that also helps. Obviously, water softens the blows, or a dog's walking, so that could maybe be another option.
Oh, there are lots of other options. So it's a room away, and I wish I could get it here. It's called an Assisi loop, and it provides targeted pulsed electromagnetic therapy. There's, to my knowledge, absolutely no side effect or adverse reaction. It minimizes or lowers inflammation. And you simply put this loop, it looks like a loop, and you place it on the dog. That's an option that actually there's scientific evidence of success for. There are several nutritional supplements that are available. You mentioned glucosamine. Some have more science behind them than others. And what works for one animal may not necessarily work as well for another animal. You mentioned, I think, hydrotherapy.
Yeah.
And that's great. But what if you can't get the cat, if it's a cat, into the pool to do hydrotherapy? Some dogs don't even like it. So the struggle to get out of the water may actually cause a problem. Or if the person doesn't have the ability to do hydrotherapy in their backyard, and most people do not, can they get to a facility that does that? There's also the expense involved in doing multimodal, which is wonderful, and I support that. But now you're doing 2 or 3 or 4 things, which cost more money. And there is also then our ability and time to do those 2 or 3 or 4 things. It turns out the best thing you could do for your dog or cat is encourage movement, if we're talking about just osteoarthritis. So play, and it doesn't have to mean the kitten is like flying off the walls like a kitten does, but the older cat is just batting and moving and being interested in that toy, has psychological benefits for that cat. And now what we're doing is we're enhancing the prey drive. For you in the UK, maybe what we do is keep that cat indoors, so nothing really bad can happen to that older cat. But on the other hand, we still need to engage that cat so that cat has an opportunity to use what they're born to do, and that is activate their prey drives. For dogs, it's no different. So rolling a ball just across a floor, perhaps a floor that has yoga mats down on it, so the dog is not sliding all over the place, is something that the dog would still enjoy doing. So it's not only enjoyment for the dog, but the other concurrent factor is, as our pets become less active, we sometimes don't feed them any differently than we did. So now we're talking about even more of a problem with obesity. It's a long answer to say one size doesn't fit all. And I'm not purposefully avoiding the question, but what works for your dog or cat is not necessarily going to work for mine, not only because of the individual animal, but the individual lifestyles involved. So what a pet parent who's 112 years old is able to do may not be the same as to what someone who's 24 years old is able to do.
Yeah, no, it makes complete sense. I wanted to get your take on this Zoetis Wall Street Journal piece, because obviously there was a Wall Street Journal article and the many negative comments about the drug. Do they affect the way you think about Zoetis and their drugs? Just for a bit of context, they say they've administered over 18 million shots worldwide. So even if a few thousand adverse effects, that will have been a very, very small amount of dogs or cats being affected. But there is mounting evidence or people with different sort of experiences saying, hey, this hasn't worked for me. And obviously, a lot of people do admit that their dog or cat already have some other issues. So my first reaction was like, right, there is going to be a very, very hard time for them to prove one-to-one correlation, causation. What's your take on the whole thing?
What you just said, by the way, is perfect, because correlation and causation are 2 different things. And it's very, very difficult as a pet parent with the emotion on top of everything else. I mean, I've been there. Our dog that wandered by, that's actually now down there, having a siesta, she had pancreatitis last year. And before even Librela came out. So it has nothing to do with Librela. It wasn't even available in the United States anyway at that point. But she was taking a non-steroidal anti-inflammatory drug. Did it actually cause that problem? I'll never know. I tend to think it might have, but I'll never know. If something happens to your pet, I'm about to rattle off some statistics.
Please go ahead.
And listen, I don't work for the company, but if backing up, if something happens to your pet, it doesn't matter what the statistics are. It could be 1 in 5 million pets. It could be 1 in 10 million pets. It doesn't really matter because it's your pet, and it's heartbreaking. And if the cases I know about, for the most part, if it's caught with the monoclonal antibodies, the solution is just to stop. And I've read about more dog issues than cat issues, anecdotally. If you stop, then soon the dog recovers. But what if the dog doesn't? And even if the dog does, the emotional trauma you've gone through, the money you've paid, it's awful. But having said that, according to Zoetis, and this is really according to the United States Food and Drug Administration Center for Veterinary Medicine in America, because Zoetis keeps track of their own numbers, but those numbers are reported. And it's not only Zoetis numbers, it's not a pharma company ever in America saying, okay, this is our adverse event report numbers. It's adverse event reports to the FDA. And it's small. It's like 1% approximately. Now, I've gotten notes back correctly saying sometimes people who are veterinarians don't make out those reports for a variety of different reasons. Or they don't even connect the possibility that it's a result of that drug. On the other hand, anything in America, other countries are different. Anything in America that's reported, because I've been through this with not these products, but other products where I've been a part of this, anything, any report. So for example, there was a product once, I don't want to say the name of the product, it was years ago, that there were some questions about. It was not a non-steroidal anti-inflammatory drug, so different class of drugs. And there was a dog that fell off a pickup truck and was killed. It's against the law in that state to keep the dog in the back of a pickup truck, but that's beside the point. And that driver blamed the drug that was given to the dog. Said that dog's always ridden in the back of a pickup truck, no problem. And now it must have been the drug. Well, really? But it's a report. So I somehow remember it was a German Shepherd dog. It was a report that was made. And because it was a report that was made, it actually accounts in America as an adverse event, even though it was unlikely to be. So we overestimate, if that's the right terminology. So it goes both ways. Some people don't report, but anything that's reported that makes it to a point where it's an official report is going to be assumed to be an adverse event. So all I know is that the number officially is about 1%. And even if it's double that, that's smaller, less than the number of non-steroidal anti-inflammatory drugs, which is commonly used in humans and previously dogs and cats, and still dogs and cats, appropriately so, for arthritis. So, I did it way back when Rimadyl came out in 1997, same company, but different company, because the company was sold over. They were called Pfizer Animal Health at the time. And I was involved in all that. And what I did was I brought in all these university professor types from University of Chicago. And they looked at the number of adverse events reported for that drug back in, it might have been 1998 at that point, but whatever year that was. And they kind of laughed. They said, listen, it's horrible for the dogs that really were affected. You know what percent of people, human beings, die because of aspirin, which I think in the UK, and I know in America, you can get and do get over the counter. And they told me that if today aspirin were to come out, it's been out for like 50, 60 years or whatever more. If it were today, somehow a new product, it would be prescription. So the point of all that, and I'm not, again, adverse responses, if it's a medication in reality, for most medications, prescription medications, do occur. If you want to take no chances, and I'm not judging anybody for anything, that's where the targeted pulsed electromagnetic therapy comes in. That's where massage therapy comes in. That's where perhaps acupuncture, incidentally, comes in. That's where walking comes in. Hydrotherapy, all these other things that, unless you drown in that swimming pool where you're doing the hydrotherapy, really can do no harm. And I'm not blaming anybody for that. It's always risk benefit, no matter what that drug is, human or a companion animal. But the risk here turns out to be really minimal. It's in both cases drugs that are specific for that species. That's what monoclonal antibodies are. So this is specific for cats And in the cat world, we're all like celebrating because there's been nothing, zero in America anyway, that's been approved for osteoarthritis specifically for cats. They've been borrowing on dog drugs with some success. For the dogs, it's still a great thing because of the way it's metabolized for dogs or cats. Again, particularly cats, where drugs that are metabolized through kidneys, that can be an issue because so many of these cats in the first place, because they're older cats, do have some renal insufficiency or some degree of kidney failure that they're already in. So those drugs probably can't even be considered or can cause a problem. So for cats especially, I would argue that these two products for cats and dogs, though, have been a savior. Are they miracle drugs? I don't know what that means. Maybe, maybe not. I don't know. But for every one comment that I've gotten that is, Steve, I've had an adverse event that seems reasonable, because some people just seem to be mad at pharma companies no matter what. But that seems reasonable. I've gotten many more. Again, all anecdotal. My outlets are not necessarily by any means everyone who's ever used the product in the world, but the data of adverse events suggests what I'm saying, and I feel comfortable doing this Librela for our cat's happily very young and doesn't have any, as far as we know, osteoarthritis issues, but our dog certainly does. And I'll be honest with you, for dogs, it seems to be some dogs it has no effect whatsoever, or hard to say. Other dogs, yeah, it's clear to say that dog is now jumping up the stair a little more, is now a little more sprightly. And that was the case for our dog. There was a difference, and I videotaped, and you could see the difference that our dog was doing things that our dog hadn't done in a couple of years. And then we didn't give the Librela for a time, in part because she was having other GI issues, nothing to do with Librela. I'm certain of that. It was gastroenteritis. And our veterinarian was certain of that. I mean, there's no even thinking about that. But my wife and I were just two people, and we have several pets, and we just didn't give Librela for just over a month, maybe 2 months, because we wanted to get her poop in shape. And that was our focus. And we didn't want to give her too much. She's sensitive. So poking her and doing all these things, we just wanted to make sure that we got that back in shape. It wasn't at the point that she needed Librela to save her life. So we did, and we got her poop back in shape. Then for a time I was out of town, and then another week I just didn't do it. I forgot. And then I gave her the Librela. And boy, I videotaped because I couldn't, my wife was out of town then, and I sent her the video. She said, "Are you sure that's our dog?" I mean, she was pulling me down the street. Again, N1, our dog. I am not suggesting this is going to be the case for every dog, but she was pulling me down the street like she hadn't in forever. And I do mean forever, because I'm a dog behavior guy. I teach my dogs to walk at my side. She's never pulled me down the street. She can't pull very hard anyway compared to me. I weigh a little more than 9 pounds. She's 9 pounds. So I was mystified, thrilled. And then I get home and she's barking at the door like she hadn't been before. She's like bringing me toys. It's like, what happened to you? So the response varies from animal to animal. The response can go like this a little bit, but bottom line, we don't want our pets to feel in pain. And if your pet is feeling less pain or almost no pain, maybe no pain, that's huge. And for most, there are no side effects involved.
I get that. I think some of the frustration that a lot of people voiced through all the comments we've received is that and again, you've just touched on that really, really well, that you should be ultimately the decision maker for your pet, and they put blind trust in their vet and they just follow guidance blindly.
I understand that. And, no veterinarian I have ever met, and I've met many, want anything bad to happen to the pets. They don't become veterinarians to hurt animals. They swear to do no harm. And that is the intent of every veterinarian I've ever met. Imagine now you're a veterinarian. You've heard about these products. You know that pet is in pain. Hopefully you offer an option or two to that pet parent. You make this option sound good because it is. It's really good for most pets, the overwhelming majority. Now, if a veterinarian says there are never any side effects and this is a fountain of youth, that veterinarian is wrong. That's stretching. But to say this is our best option given today's technology, maybe in 10 years it'll be different. I don't know. But given today's technology, they're right. This is, for many animals, the best option given today's technology. It's risk benefit. And if you are the type, again, I am not judging. If you're the type that says, I don't want any risk, zero for my pet, I'm just going to take nature as it comes and I'll do the best I can with what I can do. And we talked about some possibilities, and there are others, everything from acupuncture to that CC loop to water therapy to just walking the dog, which is always a good idea anyway. And I could talk more about that because it's so enriching. And for cats, keeping them engaged in the world, making environmental changes, huge for older animals. Create steps for that pet. Create places. They actually make cat trees for older cats now, believe it or not, that are easier to climb. I mean, there's all sorts of things we could do for cats. Warm places for dogs too, but especially cats. Warm places and soft, cushy bedding to lay down on. Keeping their weight down also is helpful. So all of those things and many more, many more, do all those things, and that's all. But to my understanding, particularly for cats, but for dogs too, giving a non-steroidal anti-inflammatory drug, which is what we've always done, which is fine, it's acceptable, is actually more risky than these products that we're talking about, the monoclonal antibodies. Is there zero risk? No. But you know what? I'm going to take our dog for a walk later, cross the street, and I could get hit by a car. You know, I mean, there are things we do every day in our lives where there is some risk, and we all have different tolerance to that. I don't believe there's any veterinarian that intentionally misleads a pet parent, and I'll stand up to that anytime.
Yeah, no, well, that's phenomenal. That's phenomenal, Steve. That's really helpful. I hope that helps a lot of people. Where can people find you? You've written some wonderful books. You have appeared all over the place. You are a celebrity in your own right. Please tell everyone where they can find you.
The most celebrated thing I do and the most fun I have is speaking at veterinary conferences, actually, not necessarily doing television, though I enjoy doing that. And I'm on the radio, but they can find me no matter where you happen to be in the world at stevedale.tv. You can sign up for my newsletter there. I do have people all over the planet getting my newsletter. How they understand English in some of the countries that get my newsletter, I don't quite know. But I'm thrilled that people do get it and do receive it, and it's very costly. It costs nothing. It's absolutely free.
The right price.
It is the right price. I like that word. And hopefully my mission is just to help pets. And therefore, if I'm doing that, I suspect I'm helping families as well.